to be helpful. And at the end of the presentation, I certainly will have time for questions. Again, I work at Cathedral Village, which is a continuing care retirement community in the Upper Roxborough section of Philadelphia. It provides all levels of service, and I've been there for off and on about almost 6 years, and this is what I do. I go out to the various centers, be it senior center, programs, libraries, clubs, and I provide health and wellness education. And I think we all need that. You know, you never stop learning. And sometimes you say, wow, that really looks interesting to me, or it has affected my life. So today we are going to talk about injury prevention. I also want to share that I am a registered nurse. I have a master's degree in education, and I have worked in Tennessee, Kentucky, New Jersey, Pennsylvania, and Indiana.
Yeah, hold the job, huh?
No, my husband can't. He's in higher education, and he was always sort of looking up that path to higher education. So he was a professor, he was a dean, he was a chancellor. So I moved when he moved. And I always, as my mother said when I went into nursing school, well, Jerry, you always have a job. And I used to curse her sometimes because I'd just get settled and all of a sudden, yes, as a nurse, you do always have a job. So that's a little bit about me. Now, again, we're talking about injury prevention, and this affects every one of us. I know I've shared I fell about 2 years ago, 2 times, and it was really unusual for me. After a battery of tests, they said I was okay, but that doesn't mean that you're still not have that fear of falling again. And that's some of the things that we will talk about today. On this presentation, I researched everywhere. The Academy of Geriatrics, Physical Therapy Association, American Occupational Therapy Association, the Mayo Clinic, Department of Health. So this is a program that it is constantly changing. Injury prevention, which I think is so important. We know we might fall, but how do you prevent that fall? Falls are one of the leading causes of injury or death among older adults. And at the end of the program, I'll hand you a flyer that will demonstrate and show you how these things have evolved. And we have new 2020 results of people who fall as they age. Emergency room statistics demonstrate older adults will seek emergency room visit as a result of a fall. So it's 3 o'clock in the morning and you get out of bed to go to the bathroom, you fall, your husband, your partner, or you just say, I don't know what's wrong with me. Maybe I need to go to the emergency room. So you call 911 and they take you to the emergency room, and the emergency room physician checks you out, does x-rays and all of that. You're okay to go home. But why did you fall? And some of those things we will talk about. A fall can result in bruises, fractures, and head trauma. Even if injury isn't grave, the thought of perhaps falling again does keep us more concerned. Once you fall, you're going to go down again. And sometimes that is true. So we have to think about how we prevent it. I like this. Most common myths about falls and the older adult. Falls happen to other people, not me for sure. I'm fine. Falling is normal. That happens. Well, it happens when old people fall, not me. Flexibility can't be regained. False. Taking medication doesn't increase risk of falling. False. I don't need to get my vision checked annually. I can see fine. And always put yourself, when I'm giving you some information, put yourself in, wow, that's true, or not me. Are falls preventable? Absolutely, yes. We'll learn a little bit about that. Falls are largely preventable, and we're going to learn how to do that today. So I'm going to discuss definitions of a fall. You didn't know you have a definition of a fall. You just went down, but you know, Webster's have many definitions of a fall. Also, we talked about fear of falling, risk factors for falling, vertigo, which is very significant. That's just not dizzy. Action steps to reduce your fall risk. What is a fall? Now, okay, this is what we're going to say a fall is. Landing on the ground or some other lower surface when you did not intend to be there. Well, that's a pretty good definition. You're landing almost on the floor or somewhere else. You're catching yourself with a chair. A fall includes slips and trips. So in other words, if you just slip or something, or you trip over something, oh, that's not a fall. I was able to hold on to that chair right next to me, but it's a fall. It's considered a fall. Now, have you had a fall? Have you had a fall in the past year? That's significant. Answer to yourself. Were you hurt? As a result of that fall, do you worry about falling? Do you feel unsteady when standing or walking? These are sort of things that you have to think about as we age. You know, sometimes you think, well, I got out of bed and I just a little dizzy, you know, and I hold on to the bedside, or I go into the bathroom and I hold on to the bathroom sink. What happens when you have this fear of falling? You limit your activities. It's a lasting concern that may cause a person to stop doing the activities she or he remains able to do so. So that fall, the first fall, might take you back and say, well, it's raining today. I'm not going to go out. I could fall, I could slip. And with the leaves and the water, it is a probability, if you're not careful, that you may slip. Why does fear of falling matter? Some people stop their activities. They don't want to fall again, because looming behind is, I fall, I fracture my hip, I go into the hospital, they repair it, then they send me to a rehab center. All of this little stuff you may be having this problem for 6 months. By the time you get treated, by the time you go surgery, by the time you recover in a skilled nursing center, by the time you go to rehab and occupational therapy, it is no little thing. So you stop your activities. So what happens when you stop activities? You're inactive. Your legs become weak. Your knees buckle. Inactivity leads to falls, may make the person feel alone, and may cause depression. If you don't want to get out there, if you don't want to come to this program today, and you say, well, it's raining, I might fall or slip, you have to start thinking of, what can I do to allay those fears? And we're going to talk about some of those things. Types of fall risk factors. Most falls result from a number of risk factors. They are physical, changes in your body that increases your risk of falls. If you have bad knees, well, that's a change in your body, because when you're 50, you didn't have bad knees, now you do. Behavioral risk factors, things we do or don't do that increase the fall risk. And you can have environmental risks. They are hazards in your home or community, and we'll talk about some of those hazards. Risk factors, again, your physical inactivity, the home environment, which we will talk about, your vision, medication use, fear of falling, social isolation, weakness, improper use of assistive devices. But what you can't change are your age, your gender, or your ethnic background. So you see risk factors on the left side that you can change. There's a lot of things that we can do to prevent a fall. What can you do? First of all, exercise to improve balance and strength. So important, because you need to have your legs, your whole body feeling, and your muscles feeling that if you start to go down, your muscles are strong and they can protect you. Have your doctor or pharmacist review your medications, which I will talk about later, because I think medications, if you read the literature that comes with every pill you get, first of all, it's like 5 or 10 pages, and you stop after the first thing saying that this can cause hazardous problems, you know. So you stop reading it because your doctor ordered it for you. So always have your doctor or pharmacist review your medicines. Have your vision checked and make your home safer. And each one of those we will be talking about. Exercise recommendation. talk to your doctor before starting an exercise program. Because, let's say you've been sort of, resting around a lot. You can't go out when we had all of these closings because of COVID. COVID has changed our life. Let's face it. And it looks like it's not getting too much better. Well, I mean, this is so minor, but talking with a mask on is about the worst thing I can do. I can hardly breathe, but I am so happy that I'm standing. I can talk. I can still do what I do with a mask on. So you talk to your doctor. Begin with physical therapy or fall prevention classes, which they have. So if you have that problem where you think, well, I am afraid of falling, or I did fall, talk to your doctor, and physical therapy will work wonders for you. Be sure your class is age appropriate. You go to the Y, where I'm just using that as an example, and it's for active older adults. And you go, and it's an exercise program. Like when I was 40, I don't think I could do. So that's what I'm saying. Be sure it's age appropriate. But if you're doing an exercise, stick with it. Home safety evaluation. Identify and eliminate hazards in your home and community. An occupational therapist can help to identify safety issues and solutions. So I say that because that's what they're trying to do. That you can say, you have physical therapy first for strengthening your muscles, but physical therapy and occupational therapy work together. So you can have an occupational therapist come to your house and look around and say, well, let's see, where can we begin? Well, the first thing she's going to say is take that scatter rug off the floor. But we'll talk more about that therapy and how to make your home safer. Medications and fall risk. Side effects of the drug may make you dizzy. And I think probably it could be as much as 60% of the medications you take. One of the little side effects may cause dizziness. Medication change may increase fall risk, and sometimes it does. Use one pharmacy. Now I know where you think, well, I know that I'm on my way home and CVS is right there. My doctor ordered a prescription. I'm going to drop in CVS. But then you're shopping somewhere, and you do know that you went to the doctor's and now you're at Walgreens. So Walgreens fills that prescription. Your drug coverage is right there. And so now you have two different pharmacies filling your medication. That's really dangerous because I know we go to CVS for not much because we have a Humana drug plan. But when we go to CVS, they know exactly what you've ordered in the past. They can tell you, well, this shouldn't be, or this should be, or there are side effects. So listen to that pharmacy. Review your meds annually with your primary care physician. Be sure you can read and understand labels. And again, we're going to talk about talking to your primary care physician. Medication compliance. Don't stop a medication without talking to the doctor. Don't. Know the names of all your medicines. List them for easy access. So all of us, as we reach a certain age, you should have the medicines written down, dosage, amount, and how many times a day you take them. Put that in your wallet, because I don't want to say this, but something can happen to you. You end up in the emergency room and all of a sudden, you're not feeling good and you can't remember even if you take an aspirin. So write them down. It's beneficial for you. Plus, it's really good when you go to a different doctor or you go to your doctor and you say, should I still be taking XYZ? So keep a list of them all the time. So again, ask for any possible side effects. Find out if you need to avoid certain food or drink while taking medications. And that's really significant. Some things you can take with water, some things they really recommend don't take with milk, but you have to really read that flyer to be able to say, this is what I should be doing. Another thing, clean out your medicine cabinet every 3 months. So I'm just going to go back to that. I have a little thing I tell people to do. You should get all of the medicines you take that are prescription and over the counter, put them in a brown bag. Now you've got to be relaxed when you're doing this. You go sit at the kitchen table, take the first one out. It's a vitamin C. Oh my gosh, it's expired. Put it aside. Go to another one. Well, this prescription I haven't taken like in 6 months, put it in other. So we have piles, non-prescription and prescription drugs. And then you can after you've divided them up, then you look at each one. Well, I didn't take the whole prescription. So what do? You save it because maybe I'll still have that problem. Don't, because that isn't what that prescription is for. You didn't take them all. Maybe they interfered with you. Maybe you got sick a little bit from it. Well, you either tell a doctor and they'll either advise you, stop taking, or we'll give you another medicine. But don't, if you stop taking it, throw it away. And I'll tell you something about that too. You don't just throw it away because somebody could find them. So that's what you clean it out. And they say every 3 months. I'll do every 6 months, whatever you're comfortable with. Take a lot of medicines that you might want to take, clean it out every 3 months, but at least do it so you know exactly what you should be taking, and or next time if you go to the doctor, if you need a new prescription refill. Vision and fall risk. Have an annual eye exam. And that's really important. Multifocal lenses may blur or destroy your vision looking down. I have multifocal glasses and they're like transition. You know, the upper level might be for seeing far, the lower one is to see close, in the middle it's like glass sometimes. And boy, if you're not, the first time you get a multifocal lens, you're saying, I can't see at all. But once you get used to them, you just love them because you don't have to change glasses. But sometimes until you get used to that, you might be a little bit concerned. Removing cataracts may reduce fall risks. And most people, when they have cataract surgery, they really need it done. You don't go through cataract surgery unless you really need to have those cataracts removed. Sometimes they say people can wait 2 or 3 years. Once they start seeing a cataract, as long as you can still see well, you can wait 2 or 3 years, but you're waiting because your eye ophthalmologist is telling you this is okay, you can still see. And oftentimes they'll say, you tell me when you want your cataracts removed, because you know, even though they could see them, if you're doing well with them, or you still can drive at night, those glaring lights coming towards you don't bother you, you're good. But when you're not, you tell that doctor, I need them removed now. Okay, vertigo. This is something different than just feeling a little dizzy. Has anyone ever had vertigo? Okay, isn't it? It's miserable, isn't it? It's not just dizzy. So what we're going to talk about with vertigo, it's a sensation when everything is moving, even when you are standing perfectly still. So you're still, and this room is moving and turning and zimming around. People with vertigo feel dizzy as though they are swaying, turning, or spinning symptoms, which are loss of balance, you are unbalanced, you pulled to one direction, you're feeling nauseated, vomiting, sweating, ringing in the ears. Believe me, you don't want vertigo. It's miserable, it's horrible. And some people say, oh, I was dizzy, or some people use vertigo as dizzy, vertigo. It's so different. Vertigo is a situation that has to be corrected. The causes of vertigo. This may be the result of an inner ear problem. You'll have to go to an ear specialist. You can have benign paroxysmal positional vertigo, and it's caused by some calcium deposits in your ear, and they have to be removed. Meniere's syndrome. It's an inner ear problem caused by buildup of fluid and changing pressure in the ear. So again, vertigo is the name of the disease, but look how many things may cause vertigo. And again, vertigo is not dizziness. It can have a vestibular neuritis when an inner ear problem is related to an infection, and generally that infection is a viral infection. Other causes include neck injury, brain problems such as a stroke or tumor, certain medications, or migraine headache. If you had a migraine headache and you have these symptoms of vertigo, not dizziness, but vertigo, this room is spinning, you really have to see the doctor and see what is causing that. This is not just normal. It is a disease. Okay, blood pressure and fall risk. If you should have your regular blood pressure checked. Some people have a blood pressure cuff at home. They might be a little hypertensive, controlled by medicine, but they do take their blood pressure at home. When you go to the doctors, what is the first thing they do? You raise your arm and they put that blood pressure cuff around you. If you get dizzy when you stand up, see your doctor. They will do the sit to stand blood pressure check. And that demonstrates to them that the dizziness might be caused by a really drop in your blood pressure when you stand. And then there are certain things that they can provide for you. And again, the easiest thing is when you stand, stand slowly. When you sit, sit slowly. Some blood pressure meds may increase fall risk. Also speak with your doctor. So everything that we're talking about, all of these things can basically be corrected if you just know, if you recognize the symptom and you talk to your doctor. Chronic conditions may contribute to fall risk. Diabetes, arthritis, big time because your bones are stiff. You have issues with pain, swelling. A stroke certainly can contribute to a fall risk. Any of the diseases, multiple sclerosis, Parkinson's disease, chronic pain. If you are in pain, wow, it really can affect how you manage your day to day, and you are concerned about fall. Depression is big time. You know, you just want to stay away from people. You isolate yourself, and all of a sudden that depression becomes so significant that you are at danger for any type of a fall risk. Chronic lung disease and chronic obstructive pulmonary disease. All of these things, the two last ones are situations that affect your lungs. They affect your lungs, you can't breathe well, and that can also very heavily contribute to a fall risk. Risk of falling may increase when you change your medicine. You know, your doctor just comes and you were taking a high blood pressure pill, you say it's a little too strong for me, change your medication, you might have an increase in a fall risk. Illness or infection, we've talked about that. Pain, some people have chronic pain and, you know, they just deal with it, but sometimes you really can't deal with it. And you get up and all of a sudden you're down on the floor because that hip gave way. Lack of sleep, I believe in this 100%. You can lose your balance with lack of sleep. And a lot of people that don't sleep well, they think, well, you know, the only thing that it's affecting is the nighttime. What it's affecting is 24 hours a day. You don't sleep well, that means that your whole balance is out of kilter. So sleep is very significant. Being sad or depressed, we talked about that. Moving to a new home or apartment, significant when you are moving. You know, you wake up, first time you're waking up in your apartment, you get up and you go to where the bathroom is. That wasn't the bathroom, that was the closet. So you have to reorient yourself because as we age, you need reorientation when you move, big time. I always say start small. Choose one risk factor to address. I always suggest a pharmacist and doctor review of your medication that may cause you to fall. You talk to the doctor and you get lists. A lot of people as we age, you have your general practice doctor and then he sends you to somebody else. Most people have 2, 3, or 4 doctors. You got to make sure that they're all on the same page with you. I talked about occupational therapists, and here again, I'm removing those scatter rugs. Physical therapy help with balance, strength training, and safe moving. I can't say enough about when you're having some factors or after a fall that you weren't injured with. I'm not talking about physical therapy. After surgery, I'm talking about you fell, you weren't injured, but physical therapy is great for that because they're going to find out, well, why did you fall? Is this the first fall? And then they're going to give you some tests, talk to you, and then they will give you balance exercises. Most all of it is covered by Medicare or your insurance. It's the best thing I can recommend because they love to work with well people. Because why? They want to keep you well. After a fall occurs, first of all, you're down on the floor. You're lying there and you want to check, you know, am I able to move my arms? Are my legs okay? You raise your leg left and right. You sort of seem okay. You call for help if needed. You seek medical attention right away if you've fallen and hit your head. There's no doubt. You know, you want to make sure that if you did fall and you did hit your head, that you are okay, that there's no bleed as a result of hitting your head. I always say when you fall and you're really concerned, it's just not like a little fall, you're flat. You call your doctor and they may suggest going to the emergency room. And again, the doctor knows you. They know that if you're calling at 3 a.m. or if the covering doctor, most people will say, go to the emergency room for your safety and for their coverage. Check for safety hazards as a result of the fall and learn how to get up safely. You just don't lie to there. You've checked everything out. Seems like you're moving everything and you pop up. Well, I don't know how many people laying down on the floor can pop up, but you do it gradually and safely. Now, to reduce your risk of falling, you can, first of all, easy. Consider changing your shoes. High heels, floppy slippers, shoes with slippery heels. Well, with this rain, I still have my heels in my briefcase because I thought, well, I can't wear, here they are, my boots, I still have them on. But make sure that you check your shoes. Don't walk around in your stocking feet. I mean, that's a disaster waiting to happen. You can just slip on the floor without any grip under a shoe. Wear non-skid sturdy shoes. Here is the one. Never stand on a chair or similar objects to get something you cannot reach. Oh, my problem with that, because I'm short. And we live in a townhouse, and the townhouse like have 12-foot ceilings. I can't reach anything. And so our son got me grabbers. And I said, well, I'm not old. I don't need a grabber. He said, did you look at your cupboards? And I have to keep everything on 1, 2, maybe the third shelf because I can't reach the other ones. And the other ones are stuff that I never use anyway, and I still don't use them. But that is so important not to stand on anything. Immediately wipe spills off the floor. Stay active to maintain overall strength and know your limitations. As we age, we do have limitations, but if you know them, you're going to be safe. If you know, number one, that you shouldn't stand on the floor, on a chair, make sure you have a step ladder. I have those little ones that are just plastic. They're very sturdy. They hold 300 pounds. And it's maybe, oh, you've seen, they're about this high. Just enough to give you a little bit of a bridge. You also can have little things that just will get a package or something out if it's on that second level and you can still reach it. So know your limitations. To make your home safer, well, I have to tell you first, as a nurse and my different places that I've lived, some of my jobs, I would evaluate residents, citizens in their home. And that was a safety check. So I'd go knock on the door, they knew I was coming. And you walk into some of these houses and there are boxes, scatter rugs. You forget when you live in your house all the time and you think it's really comfortable, really safe, you just can't imagine with things, how some people live. And it's only, I'm sharing this because it is your safety. Remove boxes, newspapers, electrical cords from a walkway. Move coffee tables and magazine racks from high traffic area. You know, sometimes you look at your house and you want everything to be, you know, really pretty and nice. So moving these things are like against what you want to do because you want your house to look organized and just like you want it. But for safety, you have to move some things. Secure loose rugs with those double safe tape or slip resistant backing. And they really do work. Now, you know, when I talk of a scatter rug, I'm just talking about when they don't have any basis underneath. It's like cotton. But when you have like a rug that you want to just secure, they really do work. It's double safe tape. You put on the rug and they don't move. Store clothing, dishes, and food within easy reach. Remember, if you're short, easy reach doesn't mean in the third shelf. Use non-slip mats in bath or tub and shower. Keep your home brightly lit. Place a nightlight in your light in your bedroom and your bathroom, always. So that when if you have to get up in the middle of the night, that light is at least bright enough for you to be safe to walk from your bed to the bathroom. Another thing that you can do is place a lamp within reach of your bed, so that when you're getting up, you have the night lights on and you're able to turn that lamp on. Make a clear path to light switches. You know, these things, think about them. When you go home, think about, you know, wow, that light switch is really, I sort of covered it. You can't even see it. Turn on lights when going up or downstairs. Always turn lights on. Downstairs, you know, and especially if now that we're going to have a change in, I think it's the 31st, we're going to have a change daylight saving time. Well, you're going to have to really change that because it is going to be darker in the morning and it's dark at night. Store flashlights in easy to find places. You should have a flashlight as we age, sort of not in every room, but easy access. So if you have an apartment, just a flashlight available. If you have a 2-story, flashlight on the 2nd floor and on the 1st floor. Flashlights are great. If you lose power, you know that at least you can have to get through the path if that works for you. Use of assisted devices. Handrails for both sides of stairways. That's hard, but that's what really does help. Non-slip treads for bare wood steps. A sturdy plastic seat for shower or tub. Grab bars for the shower or tub. A raised toilet seat. A handheld shower nozzle for bathing while sitting down. Now, these assistive devices are for you when you need them. You know, if you don't need a shower tub seat, you don't have to get it. But as you start seeing, it's a little bit harder for you, number one, to get in the tub and actually to sit with the shower or tub seat. A grab bar for the shower or tub. It's really great to have 2 of them, but at least have 1 of them. So these things that I talk about are suggestions, but they do help for safety. Medical alert system. Now, there are lots of medical alert systems, and you've all heard about them. I've fallen and I can't get up. That's the original one. But they also have medical alert systems that alert someone when you have fallen. You're not injured, but you have fallen. And medical alert is probably the one that's most known. They actually have a fall alert, and that's what your family member might need to be called when you just fall. We're not saying you're passed out. Well, obviously, if you're passed out, but medical alert is if something happens to you, you can get help. But they do include fall programs also, and that's something that is new. And I would say there's about 15 different alerts for falls. So you can just go online and you can find anything. Again, discuss with your doctor and family. Remember, move more. That's the best thing that you can do. Now, there are programs available to help. First of all, see your doctor. If you have concerns about falling, see your doctor for an assessment. Check all programs online for best fit. Go to local senior centers, area agency on aging, hospitals, or clinic. The YMCA is a great source. They provide for active older adults. They provide wonderful programs. The Y is very generous in their fee structure. So I would say the Y is really nice if you have a local one to join. And not only are you getting the physical activity, the help with balance, but it's socialization. And that is absolutely what we all need. Now I have some tips for fall prevention facts. This just came from the National Council on Aging, and it's for 2020. So this is, I would say, hot off the press. The challenge: 1 in 4 Americans age 65 plus fall each year. 1 in 4 Americans. Every 11 seconds, an older adult is treated in the emergency room for a fall. Every 19 minutes, an older adult dies from a fall. Now, these were just published. The last time they were published was in 2015. So they gather all of the information and it's just published now. And the results in comparison from 2015 to 2020 are remarkable. Why? We are all living longer, and that's a good thing, but it's very significant. Falls are the leading cause of fatal injury and the most common cause of non-fatal trauma-related hospital admissions among older adults. Falls result in more than 2.8 million injuries treated in an emergency department annually, including over 800,000 hospitalizations and more than 27,000 deaths. Now, I would say the deaths have tripled since 2015. More people are living longer. They're living in their apartments and their homes. These things happen, so we want to prevent falls. It's so significant. In 2015, the total cost of fall injuries was $50 billion. Medicare and Medicaid shouldered 75% of the cost, which is a good thing. The financial toll for older adult falls is expected to reach, as the population ages, and may reach $67.7 billion this year. Significant. That's why you're here. That's why I do this program, because falls is such a significant part of our daily life. It happens. And you're probably sitting here, you probably know people that have fallen. You may have fallen. I told you my story. I fell twice. I thought, well, the first time I fell, I thought, well, it's just, I tripped over something. The second time I fell, I thought I had to go to the doctors. And they said, well, that is significant. Well, I told you this, they ordered such a battery of tests for me. I may never tell a doctor anything. But why? Because I fell 2 times and they wanted to keep me safe. So things are happening. We want to do that. One of the things that this organization does is to make sure that fall prevention is so significant for every one of us to understand. Your children, your nieces and your nephews, make sure that they're aware. If you have any problems, share your concerns with your family, with a friend, because this is what this is all about, trying to keep all of us safe and productive. So do you have any questions at all that I could answer?
If you're joining us online, you can unmute your mics now to ask Jerry a question.
Well, I'm really happy that hopefully I was able to address your concerns, realizing that falls are so paramount as we age. And the best thing that we can do is just to be alert to it. Be alert to the fact that as we age, I've lost some of that balance that I used to have. I was a cheerleader in high school. I was doing this in college, or when I worked, I was the person that was able to do everything. Well, that's great. You still can do everything, but you have to modify what you're doing. Any questions from the group that are here? Okay, well, I do come back next week, as a matter of fact, and excuse me. I come back next week and I do have some handouts, and I'll share the handouts that we can just keep at the center. I come back next week, November 5th, and I present a program on wellness and wellness programs. So I hope to see you, and stay safe, stay dry, and I'm going to give some handouts out. Thank you again.
Thank you very much, Sherry. Thank you, everybody joining us at home. Have a great rest of your day.